Hello friends, to the previous presentations we have seen about the blood, its functions, the form elements of the blood and various other very important points. So here in this presentation we will see what is WBCs. These are the non-nucleated non-hemoglobin containing cell derived basically from hematopoietic stem cell in the red bone marrow. So as this first slide indicates that WBCs are non-nucleated and these are also very important as that of the RBCs. RBCs major function is for the transportation of oxygenated as well as the basically deoxygenated blood also, but here the WBCs are very important for the purpose of development of the immunity as well as very important functions as in the defense mechanism. Leukocytes can be divided into granulocytes and agranulocytes. The normal white blood cells count is about 5000 to 10,000 cells per cubic millimeter of blood. Granulocytes, about 75% of total WBCs are granulocytes. The cells can be divided into three types: E and B. E for eosinophil, N for neutrophil and B for basophil. Neutrophil percentage is around 60 to 70% of total WBC and stained with and neutral dyes. Lifespan is about 1 to 2 days. Average diameter is about 10 to 12 micrometer. Nucleus usually 1 to 4 lobed and functions spontaneously. Neutrophils approach the area of infection and actively phagocytes the microorganisms. Lysosomes digest the microorganisms which are phagocytized. What is meant by the phagocytized? Means it can engulf the foreign particle or either antigens. We can call it as cell engulfing or bacteria engulfing. Eosinophils percentage about 2 to 4 percentage of total WBCs. Granules stained by the red acidic dye. Lifespan is about 1 to 2 days. Diameter about 10 to 12 micrometer. Nucleus few lobes, usually 2. Functions: they migrate to the site of infection and in the tissue fluid and release enzymes like histaminase which combat the effect of an histamine. The phagocytize the antigen antibody complexes and are also effective against the parasites. The major function of eosinophil is basically for combating the effect of an histamine, because histamine has a very important role of reaching at the site of infection and it can uh, more permeable to the blood vessels. For example, if any infection is there, it can vascularize the specific blood vessels for the permeations of some protein rich fluid in it for fighting against the infection. So blood rich is very important at the site of the infection. So accordingly, it can be resulted into an swelling, dilation of the blood vessel, redness, and sometimes it can cause a pain also. So histamine has a very important role over there is, but that can also cause and some um, kind of an effects at the site of the infection. So that's why for combating against the histaminase plays a very important role over there is. What is basophils? Its percentage about 0.5 to 1% of total WBC and granules stained with basic purple blue color. Lifespan is about 1 to 2 days. Average diameter about 8 to 10 micrometer. Nucleus basically irregular and usually bilobed. Functions: basophils lives the capillaries and enter the site of infection and convert into mast cells. At the site of infection, these mast cells release histamine, heparin, and serotonin, which attract other WBCs at that respective site. So, basophils are also important, like that of the other eosinophil and neutrophils. Agranulocytes. Agranulocytes are characterized by the absence of distinct granules in their cytoplasm. But it doesn't mean that granulocytes don't have the granules. It has granules, but in a very low percentage. Granular leukocytes possesses cytoplasmic granules which are not visible under light microscope because of their small size. There are two types of granular leukocytes, lymphocytes and monocytes. What is lymphocytes? Depending upon the site of production and reaction, lymphocytes are divided into beta cells, T cells, and natural killer cells. They are divided into classes small lymphocytes and large lymphocytes. Percentage about 20 to 25% of total WBC. Nucleus generally round. Diameter is about 6 to 9 micrometer for small lymphocytes and 10 to 14 micrometer for large lymphocytes. Lifespan is about week to few months. Functions: they are needed for phenomenon of an immunity. Beta lymphocytes are converted to plasma cells which form immunoglobulins, that is antibodies, whereas T lymphocytes are responsible for cellular immunity. What is monocytes? Its percentage about 3 to 8 percentage of all WBC. Diameter is about 12 to 20 micrometer. Nucleus is oval or kidney shaped, and its functions is converted to macrophages on entering the tissue and are then highly phagocytic in nature. So as you are observing the basic structure of these granulocytes like ENB, so eosinophil, basophil and neutrophils, it looks like the same picture in the microscope. With the help of some HEP practicals, you can see these neutrophils, basophils like these with the help of an specific staining procedure. So eosinophils has an basic functions of participation in inflammation and attracts and attack parasitic worms for cell engulfing. Basophil has basic functions of participation in inflammatory pathway and releases histamine. And neutrophil has basic function of phagocytosis of an pathogens. So likewise, lymphocytes are having very major functions of antibody production and release. So antigen antibody reaction is responsible for fighting against the infection, and tumor cell control, immune system regulation. So the functions of monocytes here in granulocytes: matures into a macrophage, phagocytosis of pathogens and cell debris. Disorders related to WBC, that is leukopenia is one of the major disorders where decrease in the number of white blood cells to fewer than 4,000 cells per microliter of blood, so frequently makes people more susceptible to infections, because WBC has a very major functions of cellular immunity and fighting against the infection. So whenever WBCs are uh, low in number, it can causes fever, fatigue, body ache, sore throat, sweating, chills, cough, and trouble in breathing. So leukocytosis is nothing but an increase in the number of an WBCs and is often caused by the normal response of the body to help for fighting against the infections or to some drugs such as corticosteroids. So some white blood cells disorders involve only one of the five types of the white blood cells. Lymphocytic leukocytosis is an abnormally high number of lymphocytes. Lymphocytopenia is an abnormally low number of lymphocytes. Neutropenia is an abnormally low number of neutrophils. And neutrophilic leukocytosis is an abnormally high number of neutrophils in it.